Now let's dive deep into this big LGBTQ story for today. I'm Vaughn Biggs, and let's queer up healthcare. New study shows young adults need support to speak up about sexual health. A groundbreaking new study is shedding light on what really matters to young adults when it comes to sexual health, and it starts with talking. Titled Uncovering What Matters to Young Adults, Communicating About Sexual Health and Relationships, the research reveals that open communication is a missing link for many between good health and great relationships. Using surveys with 900 participants and 16 focus groups, researchers found that young adults want and need help having honest conversations with partners about consent, boundaries, STIs, and pleasure. The study says, young adulthood is a transitional period marked by exploration in romantic and sexual relationships, which often occur for the first time during this stage of life. Although young adults are often grouped with adolescents in sexual health research, this age group faces distinct challenges related to communication, relationships, dynamics, and accessing relevant sexual health information. The findings are a wake-up call. In 2022, nearly 50% of all new STIs in the USA were among people ages 15 to 24. Wow. Condom use remains low, and gaps in sex ed, especially for queer youth, are leaving many unprepared. Experts say it's time to meet young adults where they are. Online, messaging should include scripts, real-world examples, and practical tips on navigating relationships of all kinds, casual or committed. As a National Coalition for Sexual Health notes, good sexual health, however, is much more than disease avoidance. It also includes having positive relationships, peace of mind, and consensual, pleasurable sexual experiences, end quote. The study offers a clear roadmap, build skills, shift attitudes, and offer tools young adults need to talk about sex clearly, confidently, and safely. You know, it's very interesting. We've had these conversations about sex and being able to talk to your doctors, being able to talk to your parents, and the conversations need to be centered around queer experiences and must reflect the unique challenges faced by LGBTQ youth. And two, our medical practitioners must be trained and initiate inclusive, non-judgmental conversations that validate diverse sexual orientations and gender identities. And when it comes to the parents, you know, they struggle to find their footing between support and guidance because they're often unsure if they're being too permissive or too controlling, unaware that their voice is essential to shaping their child's confidence and values. And I think it's just so important. The communication needs to be clear. The education needs to be there. Our parents don't understand necessarily the dynamics of all the identities. And it's not about the action of the sex. It's about just educating them about sex.
And even in general, sex ed is being taken out of schools across the board because, well, it's the parents' job. Well, guess what? The parents aren't doing it.
They don't even teach them to cook anymore, let alone.
Right. I mean, it's a serious issue. Young people are getting STDs because they've never gotten the sex education that they need. Right. And learning it on the street is not healthy and it's not safe.
No.
Listen,
that's what's happening.
Sorry to interrupt. I didn't enjoy that video in sex ed. However, I learned.
You still remember.
And I remember. But I also, something that you said kind of triggered me a little bit, not in a bad way, but it was the Medicare professionals, the doctors that you're going in, because I remember that feeling. Like, I remember being a younger 19-year-old and dating older, this and that. I was out proud. My parents made it very easy for me, thank God, to come out. But you did feel judged, like as a younger gay, knowing nothing, and it wasn't. I distinctly remember times of not sharing the whole news, because I was like, oh, they're gonna think this and that, and then I mean, thankfully never had an STD, but I can see how it's easily being transmitted if you have no knowledge on the subject.
Absolutely. Yeah. Education is key.
Sure is.
I know for us, we're constantly reached out to as Holy Cross. We have a couple of colleges have reached out and want us to come into the classrooms. The professors want us to come in and talk about HIV and STI.
Yeah.
Because it's not being talked about anywhere.
Yeah. Right. Talking about protection or anything like that especially with the younger generation that are here today, we are always talking about how they're not great at face-to-face communication.
Right.
Yeah.
So while you were speaking, Vaughn, I was trying to picture two young men or two young women sitting down on the couch and talking about condoms and anything that might be going on before they fall into
right.
bed, and
Right.
I'm going, that is not happening.
Right, exactly.
You know, that it's not happening. They're not even that great at that anyway in the first place. And then they watch movies or TV shows.
Yeah.
What do people do? They start kissing, and the next thing you know, they haven't even broken the kiss. Their clothes are off and they're already.
Right.
So where was the part where they made sure that they knew who that person was and
Right.
what their,
Yeah.
you know?
Right.
Right.
They need to learn from the teachers and not,
Not
you
the
know,
TV.
not Showtime, honey.
Right.
Don't be like the friends I had, the gay men friends I had when I was in my early 20s. That was just pre AIDS being a known quantity.
Oh,
Yeah.
When I was 18,
Oh, yeah.
19, 20, and that
was
was a
last
whole
century.
different story. Shut up.
It was last century.
Different story, however, that is
Right.
still a
Okay,
big
bye.
LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.